How do I know if I have a stomach ulcer? One thing you need to remember about stomach ulcers is that not only do you need to avoid overusing anti-inflammatories, but they also have a genetic factor. If this is your case, you need to take all the precautions. Millions of people around the world suffer from ulcers. In most of these cases, it is due to an infection caused by the bacteria Helicobacter pylori, and not by food or emotional tension, as a lot of people believe. In this article, you are going to learn how to detect a stomach ulcer and how to choose the appropriate treatment. Important information about stomach ulcers. Stomach ulcers are a lesion in the membrane lining of the stomach in the first part of the small intestine, the duodenum. They affect both women and men. The primary symptom of this digestive problem is a feeling of burning in the stomach and the belly button, even if you haven't eaten anything. How do I know that I have a stomach ulcer? It's good to recognize the symptoms that a lesion in the mucous membrane could be present. This will help you choose a home remedy. So pay attention. Abdominal pain. You may feel a sharp burning between your sternum and your belly button, even without having eaten too much, or forcing some kind of movement. The pain can vary in intensity and duration. It appears most often between meals because this is when the stomach is empty. The best way to describe it is to call it burning in the belly. You will most likely suffer from this more at night and when you're hungry, or when it's been a long time since your last meal. Other symptoms. As mentioned previously, digestive ulcers present different symptoms. You need to be on the lookout for them, and remember that you may not always experience the same symptoms each time. There may even be some symptoms that you never experience. These symptoms include more belching, more gas, inability to drink liquids, feeling like your stomach is full when you haven't eaten anything, hunger immediately after eating, mild nausea in the morning, loss of appetite, general sense of malaise, fatigue, weight loss, symptoms of a severe ulcer. If you didn't pay attention to these symptoms when they occurred, and you never followed any type of treatment plan, home remedies or otherwise, your ulcer will have become chronic and will cause vomiting, sometimes with blood, dark feces that are thick and cement-like, bloody feces, tendency towards ulcers. While stomach ulcers can be caused by bacteria, some people are more vulnerable than others. Individuals that are more prone to developing stomach ulcers include those who have already been infected with H. pylori or some other bacteria. Frequently take non-steroidal anti-inflammatory medications. This includes aspirin and ibuprofen. Have a family history of ulcers. Drink alcohol in excess. Have kidney, lung or liver diseases. Are older than 50 years of age. Tips for preventing ulcers. If you are beginning to experience these symptoms, or if you belong to any of the groups associated with a greater probability of suffering from ulcers, you need to change a few habits. Prevention is the best solution. Try to stop smoking. Smoking is very closely related to developing ulcers. It is also related to poor circulation to wounds in the mucous membranes, and recurrence of ulcers as well. Avoid trigger foods. We're referring to foods that damage the stomach's health, making it more prone to suffering from ulcers. This includes avoiding preserved foods to prevent an ulcer, as well as coffee, chocolate, alcohol, mint, tomatoes, fats, spicy food, raw garlic, citrus fruits. Do not take medications. Certain pills could be helping you with pain, but they are making your ulcers worse. Anti-inflammatories used for arthritis or muscle pain damage the digestive mucosa. See your doctor for an alternative, or look for natural remedies. Juices and other ulcer remedies. If you've come to the conclusion that you are suffering from a stomach ulcer, it would be a good idea to use some of these homemade treatments for your condition. Mix 2 egg whites with 2 tablespoons olive oil and drink before breakfast. Prepare a juice with 1/2 leaf of kale and 1 celery stalk. Add water and sweeten with honey. Eat 1 boiled, green banana a day. Make a smoothie with 1 banana and 1 slice of papaya. Drink twice a day. Eat wheat bran prepared in different ways. Prepare a healing juice with 1/2 kiwi and 1/4 cantaloupe. Add the necessary water and drink immediately. Boil 2 tablespoons chamomile and 2 tablespoons of lemon balm in 1 cup of water. Steep for 5 minutes, then strain and drink after dinner. Mix 1 tablespoon marshmallow and 1 teaspoon ginger in 1 cup of boiling water. Steep for a few minutes, then drink. Make an infusion with 1 liter of water for each 2 tablespoons fenugreek. Strain and sweeten with honey. Chew and swallow 1 teaspoon linseeds. You could also grind them in a mortar and pestle, or a food processor. Make a smoothie with 2 carrots and 1 leaf of cabbage. Strain and drink between meals. Use raw honey in different recipes, like on toast or in cookies. Put 2 tablespoons of aloe vera in 1 glass of water and add 1 tablespoon honey. Drink 15 minutes after lunch and dinner. Prepare a tea with 1 tablespoon chamomile, 1 tablespoon lemon balm, and 1 tablespoon John's wort per each cup of hot water. Strain and drink.